Welcome back. In this episode, we're covering diagnosis and treatment, which makes up about 9% of the Certified Arborist exam. This domain tests your ability to think systematically. The exam is not asking you to guess what's wrong with a tree. It's asking whether you can observe, identify, differentiate, and recommend appropriate management. By the end of this episode, you should be confident working through tree health problems using a logical diagnostic process, just like the exam expects. Let's start with the most important idea in this domain. Diagnosis. This comes before treatment. Many incorrect exam answers jump straight to action. The correct answer almost always shows that the arborist has identified the problem accurately first. First step is tree identification. Diagnosis always begins with tree identification. Different species have different pest and disease susceptibilities, different stress tolerances, different responses to treatment. On the exam, if you skip identification, you'll likely choose the wrong answer, even if the symptoms sound familiar. Signs versus symptoms. This distinction is tested frequently. Symptoms are how the tree responds, things like chlorosis, wilting, dieback, or stunted growth. Signs are physical evidence of the cause, insects, fungal fruiting bodies, exit holes, frass, or spores. Exam tip. If you can see the pest or pathogen, you're dealing with a sign, not a symptom. Biotic versus abiotic disorders, another core exam concept. Biotic disorders are caused by living organisms, insects, mites, nematodes, fungi, bacteria, and viruses. Abiotic disorders are caused by non-living factors, drought, flooding, compaction, nutrient imbalance, chemical injury, temperature extremes, and mechanical damage. A classic exam trick is presenting biotic-looking symptoms caused by abiotic stress. For example, drought stress can mimic disease symptoms. If no organism is present, suspect abiotic causes first. Common biotic stresses. The exam expects you to recognize broad categories, not memorize every pest. Key biotic stressors include insects and mites, diseases caused by fungi or bacteria, vectors that spread pathogens. Questions often focus on patterns such as uniform damage, timing, and progression, not species-level identification. Common abiotic stresses. Abiotic stress is extremely common on the exam. Examples include soil compaction, poor drainage, limited rooting space, improper planting depth, mechanical injury, chemical exposure. If symptoms appear suddenly, affect multiple trees, or align with site changes, abiotic stress is usually the correct answer. Plant healthcare and IPM principles. Once a diagnosis is made, treatment follows plant healthcare or PHC principles. PHC emphasizes prevention, early detection, targeted treatment. Integrated pest management or IPM is a major exam topic and includes monitoring action thresholds, selecting appropriate control tactics, documentation, and follow-up. On the exam, chemical control is rarely the first or only answer. Integrated approaches are favored. Stress and compounding factors. Trees rarely fail for one reason. The exam often describes multiple stressors, primary and secondary pests, decline over time. Understanding compounding stress is critical. A stressed tree becomes more vulnerable to pests and disease, which then accelerate decline. If a question mentions multiple issues, the exam wants you to recognize interaction, not just isolate one cause. Developing a PHC management plan. This is where diagnosis turns into action. A PHC plan includes correct diagnosis, appropriate treatment options, consideration of site, tree condition, client goals, compliance with laws and industry standards. Communication is also tested. Arborists must clearly explain findings and recommendations to stakeholders. The best exam answers often include monitoring and follow-up, not just one-time treatment. Exam focus callouts. Watch for these patterns: signs versus symptoms confusion, biotic versus abiotic misdirection, treatment suggested before diagnosis, chemical control offered without justification, and multiple stress factors presented together. If an answer skips steps, it's usually wrong. Rapid review summary. Let's lock it in. Diagnosis starts with tree identification. Symptoms show response, signs show cause. Biotic disorders are living. Abiotic disorders are environmental. Stress factors often compound over time. PHC and IPM emphasize prevention and monitoring. Treatment follows diagnosis, never the other way around. And that's diagnosis and treatment. If you can slow down, observe carefully, and think through cause before action, you'll do very well in this domain and on the exam overall. Next up, we'll move into trees and construction, where diagnosis meets site disturbance and protection planning. Thanks for listening to the Arborist Podcast. Let's keep building your arborist knowledge one domain at a time.